The stock market getting a boost this morning when Speaker Paul Ryan, fresh off a surprise Wednesday night meeting with Vice President Mike Pence, walked up and he seemed a lot lighter. Look at him. He was actually smiling. He called it real progress, a risk-sharing plan that could address one of the biggest problems GOP holdouts have with the previous bill. Listen.
What this idea represents is a goal that everyone from the Freedom Caucus to every other group that's represented here is seeking. How do we lower premiums? How do we lower premiums and continue the protections for people with pre-existing conditions? This idea does that. And so this is one of those ideas that narrows differences and brings people closer toward consensus.
The idea is adding $15 billion to a so-called high-risk pool for those who cost more for the system. Well, is there a chance now that it's moved from the Rules Committee that we could see a revived health care push either tomorrow or when lawmakers return right away after recess? Let's talk to a lawmaker who sits on that Rules Committee, Georgia Republican Congressman Doug Collins. Congressman, okay, so it moves on next. Any chance, because we understand being getaway day today and tomorrow, that many congressional members have actually left, gotten out of Dodge. Would you call anybody back for the next stage of this vote?
Well, I think we'll always leave that option open, Liz. I think one of the things that we've always said is, number one, we want to do what's right for America. Number two, the Obamacare is an abysmal failure. So what we've done is already put together a plan that is far better than what is currently existing, and especially not helping the American people. But we're trying to get it right. We're trying to get our entire caucus together to say this is what we want to send to the Senate so that the Senate can do their job. And so what we've presented today that is going to go to the House floor when we do come back is those federal risk pools that you talked about. But there are other things still being discussed, and I think those are, conditions that we can get to the states and get a better feel on how we actually can deliver affordable health care to people. So I think if we get a deal, if we can find something over the next 2 weeks, then definitely we would come back to Washington, D.C. But the bottom line, it's not a matter of getting it fast, it's a matter of getting it right.
A lot of Americans do have pre-existing conditions, so I need to drill down a little bit on this high-risk pool. $15 billion over 10 years is sort of what we've been looking at and hearing. Is that enough? And, the criticism about high-risk pools of the past was that actually people in them were forced to pay premiums of more than 150% over the average, and that they had high deductibles and lifetime caps on coverage. Have the fine points of a high-risk pool been detailed here for Americans?
Well, I think they have been put to the point where we have our HH Secretary, Tom Price, we have CMS Director that will be working with the states to define what works. We've seen this work in Maine. We've seen it other places. We do know that this will actually lower premiums. So when you subsidize this, when you put it into a perspective, when you have the high-risk pool that allows states to build this coverage in an invisible kind of way in which you're not treating people differently because they have those pre-existing conditions, but you're able to let them get affordable, accessible health care, then I think we're going to see those numbers come down. We can already see it happening in states that have used these in the way that we're talking about. So I think it's just going to come in a lot as the HHS Secretary and the CMS Director are actually able to put this into place with the states who have the best ideas at how to lower these costs.
Well, listen, you manage almost every piece of legislation, if not every piece that goes through the House. There's a piece of legislation that hasn't even come to your doorstep, and that is a tax reform plan. The president had said 8 weeks ago that we would see a phenomenal plan start to take shape within 2 to 3 weeks, and now there are reports that the window is getting very narrow and closed and a little stuffy in the room, that we might not see tax reform this year. What do you think?
Well, that's one thing I love about this president. He's excited. He wants to do work for the American people, and he gets out there and he's pushing an agenda. That's good for the American people. And I think, just an aside note there, when you have a president who wants to do the right thing, when he includes more people frankly, in the first 2 months of his administration, he's included more members of Congress than the previous administration did in 8 years. I think that's a commitment to work. Now, tax reform, we're starting out. We've been having proposals. Our members are already meeting. Our Kevin Brady and Ways and Means have already started that process. So you're going to see a process worked out where we can work through the spring and through the summer and into the fall if need be to make sure we get it right. This is something that affects everybody. So I don't see us boxed in. I think we're trying to work through health care, then we get to tax reform, and they work together.
Yeah, some people felt it was really ambitious to take this on first. Congressman, thank you. And before you go, tell me when your flight is tomorrow back to Georgia for the Easter recess, because that may give us a hint as to whether you're considering maybe calling people back for a vote on health care.
Well, the great thing from Atlanta, I can come back at any time, but I have a special thing tonight. My youngest son is with me. We're actually going to take the train back to Gainesville today, so it's going to be a fun time tonight for he and I to spend some time together.
Okay. Thank you so much. Enjoy.